It is our pleasure to welcome all the delegates to the Fitness Prescription 4.0, which focuses on the implementation of fitness prescription in elderly for effectively managing T2DM. As the population ages and the prevalence of chronic conditions like T2DM continues to rise, the imperative to integrate holistic approaches to health becomes increasingly paramount. Among the multifaceted strategies in managing T2DM, the role of physical activity emerges as a cornerstone in promoting overall well-being. For elderly patients with T2DM, the concept of a fitness prescription takes center stage, which is an individualized and structured approach to exercise that not only addresses the unique health considerations of this demographic, but also seeks to optimize their physical and metabolic health. So to speak on this, we have a speaker for the evening, Dr. Om J. Lakhani, sir. Sir is a consultant endocrinologist working at Zydus Hospital in Ahmedabad. Sir has been a reviewer for various journals such as Thyroid Research and Practice, Current Medicine Research and Practice, Journal of Diabetes Research, and Springer Nature Diabetes Therapy. Sir has received many awards, such as he is the winner of celebrated Endocrine Society of India, Young Scholar Award. Another award Sir has received is E.V. Gandhi Award for Excellence in Endocrinology Research. He is also winner of Dr. Vitthal Rao Nadgoda for Best Thesis in MD Medicine conferred by the Association of Physicians of India. His areas of expertise include endocrine oncology, metabolic bone diseases, pediatric endocrinology, and the use of new technology in management of diabetes mellitus. Thank you, sir, for being here with us today in this session. For the next session, we have a gentle exercise routine tailored for elderly with T2DM. And for this, we have an expert from with us from Nair Hospital, Dr. Divya Rangwani. She is a clinical physiotherapist at DYL Nair Hospital, Mumbai. She has been attached to various physiotherapy and sports clinics and has contributed to various publications in various national journals. Her areas of specialization include sports injuries, pelvic floor rehabilitation, and orthopedic rehabilitation. So without further ado, I will hand over the session to Dr. Om Lakhani, sir, for the presentation for today. Over to you, sir.
Yeah, thank you so much, Dr. Smriti, for the kind introduction. And I'll start by sharing my screen. So once again, thank you to USV for having me for this very interesting session. So today I'm going to talk to you about fitness prescription in elderly type 2 diabetes patients. Now, my presentation will be in two parts. In the first part, we are going to discuss fitness prescription in adult patients with diabetes in general. And the second part is, what we're going to discuss is about in elderly, specifically in elderly, right? So this is the flow which we are going to do in the next few minutes. Now, you'll hear this term very frequently, both from me and from Dr. Divya. We are going to talk to you about what is known as a MET, right? Now, MET is what is known as metabolic equivalent of a task. And it is basically calculated as a metabolic activity during a given task divided by metabolic activity at rest. So how much of a metabolic equivalent you are doing during an exercise, that is what is basically calculated as a MET. Typically, as a convention, one MET is equal to 3.5 ml per kg per minute of oxygen consumption by a 70 kg man. So that is what is a single one MET. Now, when we measure fitness, the maximum MET which a person can achieve is a measure of what is known as fitness, right? So you're talking about fitness prescription. So what is fitness? That's the maximum MET which a person can achieve. That is what is known as fitness. Now, to give you an example, what is typically a MET of a brisk walk? A brisk walk is typically a 3.6 MET exercise, right? So that's what to give you a ballpark figure of what we mean when we say a MET. Then we have a concept called MET hours. So MET hours is basically MET of an activity into the time duration of that activity which is done, which is known as MET hours. So for example, if you are doing a brisk walk for 1 hour, it is 3.6 MET hours, right? So that is what you will say by MET hours. So now let's talk about a little bit about metabolism that changes in patients with diabetes who exercise, right? So exercise is very important in patients with diabetes. We all know that. We all prescribe exercise to our diabetic patients, but we'll see what are the benefits of the same. So one very important concept that we all need to understand, and that is the fundamental concept that you have to understand in patients with diabetes, is that exercise reduces insulin resistance. It reduces insulin resistance, right? This is a very, very important fundamental principle that you need to understand, right? In fact, to a lot of my young physician friends and my young students, there is one thing which I often teach them, that sometimes we are all forgotten a little bit about exercise, right? So I always say that our favorite drug that we use in diabetes, that is metformin, right, is like exercise, right? So all the benefits of metformin that you get from exercise, and all the little bit of those side effects that you get from metformin is also what you get from exercise. For example, why these two are very similar? Both act on the AMP kinase pathway, right? Both act on the AMP kinase pathway. So both exercise and metformin act on this pathway. Both of them reduce insulin resistance. So again, if you want to see what is the impact of diabetes or exercise on diabetes, it is basically reducing insulin resistance. Also, if you see in terms of the it can produce a little bit of weight loss, though more or less it is weight neutral. Remember, exercise is also weight neutral, but it can produce when you do a little bit of more vigorous exercise, sometimes it can lead to weight loss. Same with metformin. So these are all benefits. It has, of course, cardiovascular benefit to some extent. Again, just like metformin, there is no solid proof of cardiovascular benefit, but we all know that such benefit really exists. So you have CV benefit with exercise and with metformin. Again, in terms of side effects, if you do too much of vigorous exercise, you can develop lactic acidosis. Same thing you can develop with metformin if it is given in very high doses in inappropriate patients, right? Again, if you have a patient with heart failure or some other condition where lactic acidosis risk is higher, just like metformin, exercise can also induce lactic acidosis, though it is very, very, very rare, right? Again, exercise can produce a little bit of a reduced appetite, which is again seen with metformin. So these are all very similarities. There are a lot of similarities between metformin and exercise. So what I suggest is that if you want some additional benefit similar to that of metformin, remember metformin is the first line therapy in patients with type 2 diabetes. So same way, exercise is also first line lifestyle measure that you should prescribe in your patients with diabetes. Now, one very important question we need to understand is that is only aerobic exercise enough? We'll discuss what is aerobic, anaerobic, muscle strengthening exercise, etc. in the upcoming slides. But recent studies have shown that you need to do a combination of both aerobic as well as anaerobic or resistance training or muscle strengthening exercises apart from aerobic exercise to get the full benefit of exercise. So it is not just walking and swimming and running. You need to do some amount of resistance training also to get the full benefit from exercise prescription. So what are the benefits of exercise in patients with diabetes? Just like I told you, it is very similar to metformin. So it improves glycemic control. It can produce an HbA1c reduction of 0.5 to 0.7%, very similar to metformin again. And it has been proven in several meta-analyses that it improves the glycemic control. So this is a very well-known fact that that a good exercise can reduce HbA1c, good exercise regime can reduce HbA1c close to 0.7% on its own term. Of course, there is a concept called high intensity, low volume exercise. These are short bursts of high intensity exercise. For example, you can do vigorous cycling for 1 minute and then take rest for 1 minute and so on. So these are all high intensity, low volume exercises. These are also very effective for, of course, a lot of elderly patients may not be able to do this, but your adult patients, people, typically patients with sedentary lifestyle, this type of exercise is very, very beneficial. This can not only improve cardiovascular outcome, but it can also improve glycemic control as well. So this forms of exercise also you should consider doing. Unfortunately, I am right now in a different city than where I live. So I live in Ahmedabad. I'm in Baroda right now, but in Ahmedabad, if I had the opportunity of giving talk from there, my own entire desk setup I've set up in such a way that it's a standing desk, not a sitting desk. So most of my work that I do at home is in a standing position, and also have a little stepper in below my standing desk. So what I do is after every 20 or 30 minutes of work, I go on the stepper and do a few steps on that, and that is something which is very effective for me in my own personal way. So these are a few tips that I would like to give from my side. Now, exercise, does it reduce cardiovascular mortality? It's a controversial question, but answer to this broadly is yes. It is mainly, however, proven by prospective cohort studies. So you don't have a good RCT to prove that, but of course it is very difficult to conduct such an RCT. Having said that, from prospective cohort studies, we know that in patients with type 2 diabetes, exercise does reduce cardiovascular mortality and improves the well-being of a patient. Now, let's look at what American Diabetes Association and American Heart Association guidelines say about exercise prescription in patients with diabetes. Now, these are the guidelines. So in fact, if you want to take one screenshot of my presentation, this is the screenshot you should be taking. These are the exercise recommendations for adults with type 2 diabetes as recommended by both ADA as well as American Heart Association. So what they recommend is that there should be more than 150 minutes of moderate intensity aerobic exercise, that is exercise between 3 to 6 minutes. I told you that a brisk walk is 3.6 minutes. So about 3 to 6 minutes of exercise, that is moderate intensity exercise, is what you should be doing at least in a week, right? So 150 minutes in a week is the amount of exercise you should be doing, or 75 minutes, more than 75 minutes of vigorous aerobic exercise, that is more than 6 minutes, like for example jogging, right? So these type of, or running, this is the minimum amount of exercise they should be doing. Generally you should be doing it in a 30 minutes a day for 5 days a week, and it should spread over at least 3 days a week with no 2 consecutive days without exercise. So these are the broad recommendations as given by the guidelines in terms of an exercise prescription for adults with type 2 diabetes. So would you do resistance training? We already discussed this, and as we discussed that resistance training apart from aerobic exercise does have its own benefits. So diabetics are advised at least twice a week they should be doing resistance training, one set each of 5 different major large muscle groups. You should consider doing. Of course, there should be no contraindication to that. We'll discuss these issues as well, but that's the broad consensus which we have in terms of the recommended guidelines. Now, if you are somebody who is trying to lose weight, remember this very important concept which we all need to understand, that diet produces weight loss, whereas exercise is generally weight neutral, right? It's generally weight neutral. So this is a fundamental concept you need to understand. However, if you are somebody who wants to lose weight because of exercise, then you should consider exercising 60 minutes a day for 7 hours a week, right? So you should be exercising at least 7 hours a week if you want to lose weight, or of course maintain a good amount of weight. So that's the important recommendation that you need to understand from an exercise perspective, right? Now, of course, your patients with, these are patients with diabetes, these are not patients who are general patients. So there's some amount of pre-evaluation that you might have to do before you, or some preparation you need to do before you give an exercise prescription. So a frequently asked question is, do you need to do a treadmill test or a stress test before exercise is being prescribed? Well, answer to that is basically no. Only those patients who have claudication or chest pain need to get a stress test done. So not all patients need a stress test, right? And a sedentary diabetics who are more than 50 years must get a baseline ECG done. At least a baseline ECG should be done, but you don't need to require a treadmill test in all patients, only in patients who have prior history of chest pain or claudication. Retinopathy is something you need to be careful, especially patients with proliferative retinopathy. They need to be stabilized before exercise is being prescribed, especially for those patients who are doing resistance training. In such patients, proliferative retinopathy should be looked for, and because sometimes it can lead to trigger a bleed in such patients. So this is something. So good, a good retinal examination, fundus examination should be done before you start the exercise prescription, which is of course part of the routine care. Now, of course, a special mention should be made about patients with neuropathy. So patients with peripheral neuropathy, especially when they have loss of protective sensation, they should avoid long distance running. So marathons should be generally avoided, and if they do, they should wear protective footwear. So this is something which is very important for patients with neuropathy. Can patients with chronic kidney disease also exercise? Answer is yes, right? So there's no contraindication to exercise, but of course, very severe vigorous exercise should be avoided in such patients. Having said that, routine exercise, typically 3 to 6 minute exercise, can easily be done in patients with chronic kidney disease and diabetes. This is one rule of thumb. Of course, this is not true for everybody, but especially type 1 diabetes, you should be a little careful that before the exercise, the blood sugar should be ideally more than 100. If it's more than 250, again, you need to be careful, and they should not be having ketosis before they exercise. So this is, I think, more applicable for type 1 rather than type 2. However, these principles should be followed more or less frequently. There is a something known as a FIT model of prescription. FIT stands for F is frequency, that is frequency should be nearly daily. I is intensity, that we discussed, 3 to 6 minutes of moderate intensity exercise. T is the type of exercise, aerobic plus muscle strengthening, right? It should be done. And the T is for the time, that is at least 150 minutes a week, right? So that the acronym given for that is known as the FIT model of prescription for patients with diabetes. Now, of course, we are dealing with diabetic patients, so we need to understand that there will be some amount of blood glucose changes that occur during exercise. So what is it that you need to be careful? So if your patients are on sulfonylurea or insulin, they run the risk of hypoglycemia during exercise. So that is something we need to be careful. So you need to take adequate fluids during exercise. And if the pre-exercise blood glucose is less than 100, then you should take 15 grams of fast-acting carbohydrate 15 minutes before exercise, and repeat this carb every 30 minutes during exercise. And you should check blood glucose ideally every 30 minutes during exercise. If you're using a CGM, that's a good idea. And of course, take a long-acting carbohydrate at the end of exercise, for example, a dry fruit, etc., to prevent late hypoglycemia, right? This is something which is very important. It's something you need to understand. So when you're doing aerobic exercise, right, this is something which is important, right, to understand. Aerobic exercises lead to late hypoglycemia, right? So it often produces hypoglycemia late. And so when you have a patient who is doing an aerobic exercise, the blood sugar typically falls like this, right? There is a fall which happens. When you are doing mainly anaerobic exercises, in such cases, what happens is there is an initial spike of blood sugar and then there is a gradual fall of blood sugar, right? So if you're doing an anaerobic exercise, you will find a little spike of blood sugar at the onset of anaerobic exercise. So again, this is a recommendation which a lot of people have said, especially for type 1. So you start, if the patient starts with a blood glucose which is on the higher side, then you should do a aerobic exercise first and then end with an anaerobic, right? And if you have somebody who tends to have a little low sugar, then push with an anaerobic exercise first. So this boosts up the sugar and then go for aerobic exercise, right? This is something which is a little bit of an idea which you should consider as a little biohack for patients with diabetes. Now, patients those are not on sulfonylurea insulin, you don't need to worry about it so much. Your patients on DPP4, etc., you don't need to worry. But of course, you have to remember SGLT2 patient, there's a special mention here. Patients with SGLT2, there should be proper hydration. And also, if the patient has any evidence of euglycemic ketosis, exercise should be avoided for sure. Again, those patients who are injecting insulin, you need to understand that it should be administered in part not going to be involved in exercise. For example, if you're playing tennis, your arms are going to be involved. If you're cycling, your legs are going to be involved. So in those areas, you should not be injecting, because if you inject at those areas, the absorption of the insulin becomes unusually high, in which case it could trigger a hypoglycemic event, right? So these are some important precautions. So again, for more precautions, you should take insulin at least 60 to 90 minutes before exercise and reduce the dose of insulin by 30% at the time of the patient going to type 2, but in type 1 patients on pumps, you need to reduce the basal dose by about 30%. Okay, now let's specifically look at elderly patients with type 2 diabetes. What are the special precautions that you need to take in elderly patients with diabetes? Now, this is again second most important slide of the entire presentation. Your elderly patients, there are 4 types of exercise they should do in all of your elderly patients, right? Now, one is of course aerobic exercise. We'll discuss all of these in a little detail. Second is muscle strengthening exercise. Third is flexibility training, and fourth is balance training. So these are the 4 categories of exercise that you should consider in elderly population. Now, there is something called an easy tool. So before a patient who starts an exercise prescription, there are a few questionnaires which you need to ask. So this is called easy questionnaire, which a patient needs to answer before he or she begins the exercise regime. So the first question is, do you have any pains or tightness in the chest? So you have a chest pain during walking. This is dealing with patients who are having angina. We need to ask them, do you have dizziness or lightheadedness before starting exercise? Have you been told that you have high blood pressure? So you are again untreated hypertension. You need to be careful. Do you have pain, stiffness, or swelling that limits or prevents you from doing what you need? Do you fall, feel unsteady, or need assistive device while walking? Remember, we are dealing with elderly patient. Is there a reason, not mentioned why you should be concerned about starting an exercise program? So these questions, these 6 questions should be asked to all your elderly patients before they begin the exercise program. Right now, let me give you an algorithm of how to really based on the easy question. You need to see whether you need to do a pre-operative evaluation, pre-procedure evaluation or pre-exercise evaluation in your diabetic patient. So if the patient has any of the of the 6 questions that we asked, if any of that is yes, then the patient needs a medical clearance. So you need to do a exercise stress test before. Remember, these are elderly diabetic patients, so you need to be careful. However, if the patient, the answer to this is no, there are no such issues, then you need to see if the patient has diabetes, cardiovascular disease, chronic kidney disease. Of course, we are dealing with diabetic patients. So again, in such cases, if they have such a history, then you need to, if the patient is already exercising, you don't need to worry. But if the patient is not exercising, again, it's a good idea to do a medical clearance. So again, diabetic elderly patient, it would be a good idea to consider doing a stress test in such patients. Routine patients, you need not to worry about, right? Again, if such patients there is does not want to pursue any intense exercise, then you don't need to worry about it, right? So you can check out this algorithm. This is taken from UpToDate, so it's available there. Again, if the patient is not diabetic, then of course you don't require medical clearance in routine cases before you begin exercise, unless of course you have some other risk factor involved. Right, now let's look at aerobic exercises in more detail, and what is aerobic exercise, and some examples of this. So aerobic exercise is something which involves sustained use of large muscle groups, and it stimulates and strengthens the heart and lungs, and it improves the body's ability to utilize oxygen. So some examples of aerobic exercise are brisk walking, jogging, swimming, tennis, golf, right? These are all examples of aerobic exercise which your elderly patients can consider doing. Again, AHA recommendation for aerobic exercise, we already discussed: 150 minutes a week, 30 minutes for 5 days, moderate intensity, or you can do 60 minutes per week of vigorous exercise, right? So these are the examples. If you can, this is ideal. Of course, this is in patients who want to do more vigorous exercise. They can do a 60 minute per week of vigorous exercise. Okay. One very important thing you need to do, you need to judge. How does the patient judge the intensity of exercise? Now, of course, we talk about MET and all that, but at a patient level, again, a very useful hack for the patient, for doctors to really talk. How do you judge the intensity of exercise? So you need to give a scale between 0 to 10. 0 is when the patient says that there is amount of effort used while sitting, right? So how much of an effort does the patient have to put while exercising? That is what we need to really or how much is the vigorousness of the exercise which he or she is doing. So if it is equivalent to sitting, it is 0. If it is 1 to 4, then you have lower effort levels below moderate intensity. When it's 5 to 6, it's defined as moderate intensity exercise, which produces a noticeable increase in breathing and heart rate. So if your exercise produces a little bit of increase of breathing and heart rate, that score is 5 to 6. So that is what you need to ask. This is the level of, this is moderate intensity exercise. And then when you have levels of 7 and 8, that is vigorous exercise, that increases more amount of breathing and heart rate. Of course, these are rough definitions. These are rough guideline. And 9 to 10 is very severe exercise where there is a great amount of effort which is involved, right? So we should be targeting somewhere here, right? 5 to 6 or 7 to 8. Generally 5 to 6 is the a sweet spot in terms of exercise on a rigorous scale, right? Now, this is a very useful rule of thumb that you need to understand, right? Now, what you need to understand is that what is a very vigorous exercise? If the individual should be able to carry out a conversation during the activity, right? During the exercise, the patient is able to carry out a conversation, that is considered to be a reasonable amount of effort, and that is not considered to be too high, right? So that's the broad rule of thumb that you need to understand. Now, then you have muscle strengthening exercises. These are anaerobic exercises. So we already discussed that adults with elderly, especially with type 2 diabetes, you need to do both aerobic exercise as well as muscle strengthening exercise. So what are muscle strengthening exercises? This could include weight training, calisthenics, like for example, push-ups and squats. You could do resistance training, and you could have, so these are all examples of muscle strengthening exercises. Of course, then of course you have flexibility training. So flexibility training is basically, these are things where it's basically stretching and these kind of exercises where the patient generally stretches. Now, you need to hold the stretch for about 10 to 30 seconds. I'm sure Dr. Divya is going to show you some examples of flexibility training. So flexibility training is very, very important, especially for your elderly patients with type 2 diabetes. And then you have balance training. Balance training is also equally important. A lot of patients with type 2 diabetes who are old, they often have dizziness and balance problem, and balance problem leads to fall. So fall is very, it's a big problem, right? We are going to discuss one slide about osteoporosis also. So fall is a big problem in elderly patients, so you need to consider balance exercises, right? What are examples of balance exercises? So, there's a Chinese martial art called Tai Chi. You have heel to toe walking, right? You have, center of gravity awareness, a sensorial a system augmentation. These are all things which, a physiotherapist would be able to tell your patient. So you need to consider balance training as well in your diabetic patients. Some few tips when you incorporate an exercise program. So all the programs need to be individualized, right? So your program, it cannot be one size fits all. You need to see your patient, and depending on your patient, you need to recommend exercise depending on their age and health status. Again, you need to understand the concept of start low and go slow, right? So you need to start low. You cannot ask a patient to start going to the gym and lifting 10 kgs of weight. That's not going to happen. You need to start low and go slow and gradually build up a exercise regime. It's always a good idea to have an exercise buddy, right? So again, maybe the spouse of the patient or maybe a friend, right? If they have a friend or a spouse or somebody with whom they can exercise, it really helps them maintain their exercise better. So what should be done for patients who are too frail to exercise? Yeah, there'll be some old patients who are very old and who are not able to exercise at all. Even 5-minute walks twice a day, right? Simple prescription of 5-minute walk twice a day is very useful in terms of the overall outcome of the patient, in both in terms of well-being as well as in terms of mortality reduction. A special mention for patients with osteoporosis. So osteoporosis patient, the problem is that these patients, if they fall, they can fracture. So you need to be careful about these patients. So you need to, of course, give them standard activity recommendation, but emphasis on weight bearing and strengthening activities is very important. Of course, at the same time, you should make sure that they do not get injured or fall. And gradual strengthening programs should be considered in such patients, because they that really. So remember, there is a bone and muscle, segment, right? So if you increase the muscle strength, the bone also is protected in a better way, right? So these are some recommendations for osteoporosis patient, right? So this was my presentation. Again, for people who are more interested in this and similar topics, we have 2 books we have published. These are from our very popular Notes in Endocrinology series. We used to have an app which we have pulled off right now, but these books are available. The Best of Notes in Endocrinology, and we have a new one which is released, which is Best of Notes in Endocrinology Diabetes Special. This is a new volume which we released, so you can check it out. These are available on Amazon. And thank you for a patient listening.
Thank you so much, sir, for taking us through the elaborative presentation. And with that, I would now invite Dr. Divya Rangwani, ma'am, to take us through the exercise routine, which is tailored specifically for elderly individuals with T2DM. Over to you, Dr. Divya.
The components of exercise to be followed in patients with diabetes are strength, endurance, flexibility, and agility already mentioned earlier. So according to the ACM guidelines, following the frequency, intensity, type, and time, that is the FIT principle, aerobic exercises are to be done 5 times a week, strengthening exercises are to be done 2 times a week, whereas balance are to be done 3 times a week. Components of aerobic training will involve warm-up exercises, which will help to prevent any injury. It involves mobility as well as stretching exercises. In aerobic exercise, as Saras mentioned, for moderate intensity exercise, 150 minutes per week has to be done, and for vigorous exercise, 70 minutes has to be done, depending upon the target heart rate which needs to be achieved and the amount of breathlessness that is on box scale, how much exertion the patient is feeling. The cool down exercises involves relaxation and breathing to bring down the heart rate to the normal level. The stretching exercises has to be done 3 times a week, pre and post the aerobic session. The stretching exercises is to be hold for 20 to 30 seconds and has to be done 2 to 3 times. First 3 times has to be done on one side, on different side it has to be switched. Larger muscles like your postural muscles, hamstrings, quadriceps, your pectoral muscles which maintain your posture are to be done. For your neck, trapezius and levator scapular stretches has to be done to maintain the posture in elderly. As we see, they tend to slouch. So in this videos, we can see the patient is being doing the stretching exercises. The mobility exercises involves joint mobility exercises for major limbs such that shoulder joint, hip joint, knee joint, elbow, ankle. So all these mobility exercises can be done. Mobility exercises are to be done in the warm up exercise to prevent any injury to the joint, which is followed by aerobic exercise. Aerobic exercise, as sir had mentioned, can be done for 30 minutes in a day for 5 times in a week, which involves activities such as marching, stepping, walking, depending upon the mat value, as sir already had mentioned, that for moderate activity we need 3 to 6 mats, whereas vigorous activity involve mat activity of more than 6, then which is to be followed by strengthening exercises. As in elderly, we see that the muscle mass reduces and fat mass increases in elderly. So we need to maintain strengthening exercises for major bulk of muscles such as your gluteus, your pectorals, your deltoids, core. All these muscles to be strengthened to target stability and strength in the elderly. The exercises can be done freehand or with as the exercise strength of the joint increases. For lower limb exercises, major exercise which needs to be followed are squats and lunges, as these are activities which are followed by individuals in their day-to-day activities and helping their functional mobility. So in strengthening exercise, it has to be followed with free weights or with uh, weights. Then for lower limb strengthening, squats and lunges are to be followed since they are the bigger muscles, which are anti-gravity muscles and help to maintain the functional mobility of the elderly. For balance exercise, since we know there is increased risk of fall in elderly and the risk of fall decreases by 23% as seen in research, the following exercises are to be done such as heel raises, toe raises, single leg stands, tandem walking. First with eyes open and there's eyes closed. Then surface needs to be challenged, I suppose, on firm ground. Then we can progress on to the soft ground for increasing the challenging of exercise.
Thank you, Dr. Divya, for the elaborative presentation with the videos. So it can be useful for everyone who is watching this session.
Good evening. I'm Dr. Sonal Vichare. Divya seems to have some technical problems. So almost half of the PPT has been already shared. So what we emphasize as physiotherapists is start slow, but then go gradually. Because whenever we are treating this geriatric population, we need to be extremely sure of the other comorbidities along with the diabetes, hypertension, thyroid, and other such problems. So whenever we suspect any such problems, we directly do not start the exercises on ground level. First, we start with the aquatic therapy. So if the patient is affording, if the feasibility is there, then definitely we would like to go for the aquatic therapy first, wherein the body weight is transferred to the water by the buoyancy property of the water. Once the patient is comfortable, the geriatric population is comfortable inside the water, then we take the patient for the floor exercises. The frequency of the exercises of patients, the geriatric patients coming to physiotherapy OPD is thrice in a week. So that exercises which are taught to them are to be carried out at home as well on the alternate days basis. One day is kept as a rest day for them. Secondly, we take care of the nutrition as already demonstrated by Dr. Lakhani. So the nutrition is of utmost importance. We have seen patients getting hypoglycemic during the session, collapsing suddenly. So in that case, we have to be extremely careful with the prescription of the exercises. Secondly, we have to have some pre and post test criteria, pre and post exercise prescription criteria, wherein we judge the patient, the geriatric population basis how they were before, and then secondly how they are coming back to us after a certain period of time. If there is some reporting of any complications, any increased aches and pains, we either send them back to the consultant, or we reduce the frequency, intensity, or the other parameters of the exercise prescription. Secondly, all these patients, we have to have a great family support, because unless and until the patient is accompanied by one of his family members, no outcome can be possible from their side as well as from our side. And thirdly, the mental rehabilitation, the mental well-being of the patient is as important as the physical well-being. So if need arises, we send them for the relaxation sessions, the meditation, and we have certain relaxation techniques like Jacobson's method of relaxation, wherein we put the patient in cozy atmosphere, and then the gradual relaxation of each and every muscle, each and every joint is taught to them periodically. So this is how we go about the exercise prescription. Secondly, as sir said, the exercise prescription has to be tailor made. It cannot be one size fits all. So the initial assessment, the continual assessment during the program, and the one final assessment is always essential. Thank you.
So, sir, we have few questions from the audiences. So,
Yes.
shall we take, sir, one by one questions?
Yes, please do. Please do.
Yes, sir. So the first question is, sir, that what should the patient do in case of any adverse reactions or emergencies during or after exercise? In
Yeah.
elderly? Yeah.
Yes. So it's a great question. I think the biggest worry, there are two important things we need to worry about. One is the hypoglycemia, which is a problem which we need to understand that could be, patient could have a trigger of hypoglycemia. Second is perhaps a cardiovascular event which could be triggered during the exercise event. The third, of course, is a more mechanical thing, that there could be a fall. Right. So these are three very important, things we need to understand. So first and foremost, a very good planning of the entire exercise system needs to be done by both the physician, the physiotherapist, and the patient themselves, and the patient's relatives. So, a good planning will prevent these adversities from happening. Right. So that's where the solution really starts from. But of course, if you have a hypoglycemia, we all know how to correct hypoglycemia. So, again, that rule of 15, where you need to give a 15 gram of carbohydrate. First of all, of course, if you have a glucometer handy, check it. And if you have, glucose available, give 15 grams of carbohydrates. Again, places where, elderly are with diabetes are, using as exercising, I think the glucose should be handy and should be easily available, right? So again, glucose can be given to them. Especially when they have even early symptoms of hypoglycemia, that could be corrected. Secondly, if you have, of course, a cardiovascular event, it's of course very important that places like, for example, gyms or households, maybe societies and buildings, there should be availability of defibrillators, availability of emergency first aid equipment, and perhaps somebody who is a doctor in the building could be called, and the needful thing can be done, right? So maybe basic CPR and other things can be considered. Thirdly, of course, if you have a fall, it's very important that immobilization at that point of time is very important. Sometimes there could be vertebral fractures, which could if again misplaced, could lead to permanent neural damage, which is important. A lot of these patients can develop a fracture neck femur. So again, immobilization is something very important. So if you have an elderly person who is falling, always assume the worst, always assume a possible cervical vertebral damage. So again, if you're not trained in carrying these individuals, it should be you should be very careful of moving them. It would be always a good idea to call the emergency services for that. A lot of states have now 108 ambulances or 101 ambulances, so this can be called and asked to help, and the patient should be taken to hospital with the proper ER precautions. So these are some things which you need to be very well aware. Again, good anticipation of these problems is always more helpful. So again, we need to plan these things better so that eventuality of such a thing does not happen.
Yes, sir, rightly said. And so one more thing is that in addition to exercise, we have other lifestyle changes also, like diet, sleep, and stress management, which is also important for the elderly patients with kidney. So what are the recommendations for in these lifestyle changes which they have to follow?
Yeah, so I think of course, each of the lifestyle measure is a probably a webinar in itself. So again, we look at broad ideas. So I'm sure diet is something which can be extensively discussed separately, but I'll stress upon the other lifestyle measures. And I think for elderly, I think a very important lifestyle measure is that the cognitive function of elderly remains intact, right? So they need to be engaged in maybe some sort of a recreation or hobby, especially those who are retired, because keeping the cognitive faculties intact is very, very useful. If a lot of studies which have shown that elderly people who do not have dementia, people who have good strong cognitive function, actually have better longevity, and better they're more contributory to the society as well. So I think engaging them in fruitful hobbies which they can perform, perhaps they could be given, for example, some administrative tasks in the society, maybe some administrative tasks at home. They could be teaching their grandchildren, those kind of things already keeps them engaged, and that is very, very important for older people to feel that sense of self-worth, and other things, right? Sleep is constantly a problem in elderly patients. A lot of these elderly patients are actually prescribed a lot of sleep medications, which can also lead to other problems. For example, we have seen a lot of sleep medications induce hyponatremia. It's a very common problem in elderly patients. So again, as physicians, we need to be careful about prescriptions we give them. At the same time, again, sleep being a problem in elderly and quality of sleep being a problem, it's always a good idea that they consider doing evening exercises, where again, maintain good sleep hygiene. By doing that, they are able to able to have better sleep and better quality of life in that regards. So I think these are some important messages which we need to do beyond both diet and exercise, which need to be taken care of.
Dr. Divya, are there any strategies or exercises that can help manage chronic pain commonly associated with aging and diabetes?
Yes. Since chronic pain, it involves central sensitization also. There is changes at the brain level which alter the signals which causes chronic pain over the time. So to reduce the chronic pain, we can give them relaxation exercises, breathing exercises. Along with that, you need to follow on the overall aspect of exercises, since it will help to increase their overall well-being and reduces pain over the particular joint which is present there. So we need to focus on to the exercises which reduces your stress. So mainly relaxation exercises needs to be given in chronic pain.
Okay. And one more question is that how can strength training be safely incorporated into the exercise routine, especially for individuals who have muscle weakness or atrophy?
So, as Sir had already mentioned, that exercises with weights are to be avoided in patients with retinopathy and with chronic kidney disease. So, you first need to check with indications and contraindications of exercises with elderlies, and you have to put equal amount of stress onto the Valsalva maneuver if they are breathing properly while doing exercises or no. As their atrophy is being seen in elderly, we need to focus onto the progressive resisted exercises. First, we need to calculate their repetition maximum, how much they are able to do with particular amount of weight. With that, repetitive exercises are to be given following each set of exercise for each muscle. That is 2 to 3 sets are to be done for every bigger muscles in the body, which involves your quadriceps, your hamstrings, your gluteus in the lower limb, and for upper limb, your pectorals and deltoid and rotator cuff muscles are to be targeted. So in these muscles, the exercises with progressive weights are to be done.
Sir, how frequently should the patient have follow-up appointments to assess the progress and make adjustments to the exercise plan? And what they should monitor on their own?
Yeah, I think it's a good idea to review these matters whenever you are dealing with a follow-up of such patients. For example, you look at you generally call these patients at 3-month intervals for the routine checkups, HbA1cs, and so on. So at this point of time, it would be also a good idea to at least have a word about their exercise regime which they are considering or they're already doing, right? Again, the routine safety checks can be done at that point of time. So I think probably we don't require a special visit from the elderly for these issues, but whenever you're calling them for the routine health checkups, your diabetes medications and prescriptions and all that. At that point of time, you can consider at the same, along with the routine check, you can also consider doing the exercise evaluation also in that sense.
So one more last question is there, that are there any specific signs of overexertion or strain that the patient should be aware of?
Yeah, I think the usual chest pain, very, very important. So angina and angina equivalents are something which we need to be aware about. Angina equivalents so chest pain itself is basically, that's angina. So that of course needs to be looked at. But angina equivalents, for example, extreme fatigue is an angina equivalent. Some people experience severe breathlessness, which is again form of an angina equivalent. Some people can have non-specific pains. For example, sometimes they can have a abdominal pain. So these could also be signs of non-specific signs of angina. So when you have some non-specific complaints, issues, or sometimes they can have intermittent claudication and all that. So these are important signs that you need to look at, and these are often again associated sometimes with overexertion as well, or sometimes it could be freak events. So again, these are things you need to be watching out for. Again, dehydration is something very important, right? So they start having dizziness and other such clinical symptoms. Sometimes even vertigo or syncope. These need to be looked at and addressed.
Dr. Divya, same question to you. Would you like to add on to sir's answer?
So, as Sir had mentioned, considering the box scale for the breathlessness, if the patient is not able to speak while doing exercise, and if they are suffering any chest pain while doing exercise, they must stop at that time, and their BP, heart rate, and pulse rate should be monitored throughout the time of the exercise. And once we feel that patient is not feeling well and they are getting any discomfort, the exercises needs to be stopped.
So, sir, with this, we have come to an end of the session. And to conclude, I would say a tailored fitness prescription is actually needed for elderly type 2 diabetes mellitus patients, which represents a crucial aspect in addressing both the unique health challenges of aging and the complexities of diabetes management. Thank you so much, Dr. Lakhani, sir, for taking us through the metabolic equivalent of a task in your presentation, pre-evaluation parameters which you have discussed with us, medication adjustments needed to be made during the exercise for these elderly patients, which is very actually important for everyone, for these elderly patients to be known that what adjustments they have to make while exercising. So thank you so much, sir, for highlighting those important points with us in your presentation, and I'm sure all the delegates who have joined, they have gained that insight in a very crisp way from you. Thank you so much, sir.
Thank you, Dr. Smriti. It was a pleasure. Thank you so much.
Thank you, sir, and thank you, Dr. Divya, for taking us through your presentation also, and giving us that how we elderly patients has to do the exercises in a form of video format. Thank you, Dr. Divya.
Thank you.
Thank you, Dr. Smriti. Thank you.
And thank you to all the delegates who have been present for the webinar today. And lastly, I would thank my organizing committee members and digital team who have made sure for the smooth execution of this program. Thank you so much, everyone. And with that, good night.
Good night.